Whether you're a seasoned athlete or just someone who enjoys a good walk, knee pain can really cramp your style. The knee is a complex joint responsible for much of our mobility. When it hurts, it can feel like everything comes to a standstill. We'll break down common causes and discuss what you can do to find relief. From overuse injuries to arthritis, I'll give you tips on managing pain and reducing inflammation. Stick around because understanding your knee pain is the first step towards feeling better. Our bodies are capable of amazing things, but even the strongest knees have their limits. Repeated stress from activities like running, jumping, or heavy lifting can lead to overuse injuries. These injuries develop gradually, causing small tears and inflammation in the tendons, ligaments, and muscles. You might feel nagging pain, stiffness in the morning, or tenderness around the kneecap. Common overuse injuries include patellar tendinitis, affecting the tendon connecting your kneecap to your shinbone, and iliotibial IT band syndrome, involving inflammation of the tissue running along the outside of your thigh. Sometimes knee pain strikes suddenly due to an injury or trauma. This could be from sports, a fall, or a car accident. The impact can cause sprains, ligament tears, meniscus tears, or fractures. These injuries often come with intense pain, swelling, and difficulty moving. See a doctor for proper diagnosis and treatment. Early intervention prevents long-term complications. Our knees have small fluid-filled sacs called bursae that act like cushions between bones, tendons, and muscles. They help reduce friction and allow for smooth movement, but sometimes these bursae can become inflamed, leading to bursitis. Bursitis causes pain, swelling, and tenderness. Prepatellar bursitis, or housemaid's knee, affects the bursa in front of the kneecap. It's often caused by repetitive kneeling. Treatment involves rest, ice, compression and elevation, rice, and over-the-counter pain relievers. Arthritis is a common cause of knee pain, especially as we age. It leads to inflammation, pain, stiffness, and reduced mobility. Osteoarthritis is the most common type, a wear and tear condition that develops over time. Rheumatoid arthritis and gout can also cause knee pain and inflammation. Tendons are tough cords of tissue that connect muscles to bones, allowing joint movement. When tendons become inflamed, it's called tendinitis, causing pain, tenderness, and stiffness. In the knee, the quadriceps tendon connects the thigh muscles to the kneecap, and the patellar tendon connects the kneecap to the shin bone. Tendinitis is often caused by overuse or repetitive motions, common among athletes and people with repetitive knee movements in their jobs. Ever felt a strange bump behind your knee? It could be a Baker's cyst, also known as a popliteal cyst. This fluid-filled sac often results from knee issues like arthritis or a meniscus tear. Baker's cysts can cause tightness, swelling, and pain. They can even interfere with knee movement. Treatment depends on the cause and severity. Rest, ice, and compression can help reduce swelling. Your doctor might recommend physical therapy or draining the cyst. While rare, an infection in the knee joint known as septic arthritis requires immediate medical attention. This infection can occur when bacteria enter the knee joint through an injury, surgery, or infection elsewhere in the body. Septic arthritis causes intense pain, swelling, redness, and warmth around the knee. You might also experience fever, chills, and difficulty moving the joint. Seek medical attention immediately if you suspect a knee infection. Early diagnosis and antibiotics are crucial to prevent permanent joint damage. Gout and pseudogout cause sudden, excruciating knee pain. Sharp crystals build up in the joint, triggering intense inflammation. Gout is from uric acid crystals, pseudogout from calcium pyrophosphate crystals. Both cause severe pain, swelling, redness, and warmth. Treatment involves medications to reduce inflammation and pain, and lifestyle changes to prevent flare-ups. Patellofemoral pain syndrome, or runner's knee, causes pain around the front of the kneecap. It's related to overuse, muscle imbalances, or improper kneecap tracking. Runners, cyclists, and those in repetitive knee stress activities are susceptible. Pain worsens with stairs, squatting or sitting with bent knees. Treatment involves rest, ice, compression and elevation, plus physical therapy to strengthen muscles and improve tracking. When it comes to knee pain, the best medicine is often rest. Allow inflammation to subside and avoid activities that exacerbate pain. Engage in low-impact activities like swimming or cycling. Ice is a powerful tool for reducing pain and inflammation. Apply an ice pack for 15 to 20 minutes every 2 to 3 hours. Ice constricts blood vessels, reducing swelling and numbing the area. Always wrap the ice pack in a thin towel to protect your skin. Compression reduces swelling and supports the injured knee. Use an elastic bandage or sleeve, wrapping snugly but not too tightly. Remove periodically for proper circulation. Elevating your knee above heart level reduces swelling by promoting fluid drainage. Prop your leg up on pillows or cushions so your knee is higher than your heart. Gravity helps draw excess fluid away from the injured area, especially in the first few days after an injury or during inflammation. Over-the-counter pain relievers like ibuprofen or naproxen help manage knee pain and reduce inflammation. These NSAIDs are effective, but acetaminophen, like Tylenol, only relieves pain without reducing inflammation. Always follow dosage instructions and consult your doctor if pain persists. Once the pain and swelling subside, start gentle stretching and strengthening exercises. Focus on low-impact exercises like quadriceps and hamstring stretches. Gradually increase intensity and duration as your knee strengthens. A physical therapist can help you overcome knee pain. They assess your condition, create a personalized exercise program, and provide treatments. Techniques include manual therapy, therapeutic exercises, electrical stimulation, and ultrasound to reduce pain, improve mobility, and strengthen knee muscles. Knee pain can stem from foot mechanics issues like overpronation or supination. Supportive footwear with good arch support and cushioning can help. Custom orthotics from a podiatrist may provide additional support and alignment correction. Topical treatments like anti-inflammatory creams or gels can provide localized knee pain relief. These medications reduce inflammation and pain signals. Apply the cream or gel to the painful area as directed on the product label. Your diet and lifestyle can impact knee pain, especially with conditions like gout. Maintaining a healthy weight reduces stress on knee joints. Eat plenty of fruits, vegetables, and whole grains, and limit processed foods, sugary drinks, and unhealthy fats. So there you have it, a comprehensive look at the causes of knee pain and what you can do to find relief. Remember, taking care of your knees is crucial for staying active and enjoying life. If your knee pain is persistent or severe, reach out to a healthcare professional for proper diagnosis and treatment. They can help you manage your pain and get you back on track. Thank you for watching. Take care and keep those knees healthy.